Practitioners of traditional medicine, commonly referred to as traditional healers, are well respected in the communities in which they live. They prepare and use medicines to treat various diseases and conditions, and provide advice to clients on the prevention of health risks that affect them in their lives. Their contribution to health development is widely recognized. The 12th African Traditional Medicine Day, to be held on the 31st of August 2014, under the theme Collaboration between Practitioners of Traditional Medicine and Practitioners of Conventional Medicine, emphasizes the need to strengthen partnership between the two systems of medicine.
It is essential that this collaboration takes place between conventional medical practices and traditional medicine. This is important because, as you probably know, some 80% of our population in the region will use traditional medical practitioners at one time or the other, sometimes at the same time as they're using conventional practitioners. And so it is essential that this collaboration takes place to avoid duplication of efforts, to ensure that we reach the majority of our people with services, especially as we move into these universal health coverage sort of policies. And also, it is essential that we foster this collaboration to make sure that all our health practices are safe to our population.
Many modern health workers and traditional practitioners collaborate and agree that traditional medicine must take its place to be integrated into national health systems and health services. As a result, many traditional healers have established their own healthcare facilities, including herbalist centers.
Bavarie Center was officially inaugurated in 1998. We work in harmony with conventional health practitioners as we don't do medical examinations on our own. We do clinical examinations in close collaboration with our colleagues of the conventional health system. Bavarie Center collaborates with the conventional health system in various areas such as gynecology and disease management. Disease management includes management of diabetes, hypertension, malaria, and many others. In gynecology, I collaborate with Dr. Kubaka. He is a specialist, he has good materials and good results.
Je suis content de cette collaboration parce que il faut se dire que
I'm happy with this collaboration because traditional medicine does not have many resources such as the echograph equipment behind me, which gives us the opportunity to explore and have a panoramic view of the belly to see if there is a condition affecting it. Hence, collaborating with traditional medicine is a good thing because it helps this sector understand what its limits are. Conventional medicine also has its limits. Traditional medicine has limits. For instance, there are conditions that require surgery interventions that traditional healers do not perform.
Ils ont des limites sur certaines pathologies qui sont, par exemple, chirurgicales.
Once Dr. Kubaka is made his diagnosis and provided the results to us, we give the treatment to the patient, and in collaboration with Dr. Kubaka, we supervise the patient's health from the beginning to the end of the treatment and beyond.
J'avais un kyste à l'ovaire.
I had a cyst on the ovary. I went to see Dr. Balandamio, a traditional healer. He gave me a medical bulletin and referred me to Dr. Kubaka, a gynecologist. He made an echography. He diagnosed my condition and sent me back to Dr. Balandamio. I was on treatment for 2 months. After 2 months, I went to Dr. Kubaka for a medical examination. The results were good. I would like to take this opportunity to stress the importance of collaboration between traditional and conventional medicine. Thanks to these two medicines, I have 2 children.
Il nous est pas encore arrivé d'utiliser.
We haven't had the opportunity yet to use traditional medicines, but sometimes we are satisfied. Take the example of a woman with an ovarian cyst. When she has been using traditional treatments and that we do the ecography, her cyst has disappeared. This is a very good result, and we think that it should be used to manage women's health.
I think it's essential that we start doing things in a regular scientific manner. And having such a framework allows traditional practice to follow certain rules and regulations that makes it as safe as possible. And so make it easier to integrate that into conventional medical practices. I think it's also important because it allows countries to understand and investigate the effectiveness of traditional medicines. In addition, we also encourage better regulation, establishment of registers to make sure all our practitioners, whether conventional or traditional, are registered. It's one of the ways that we make sure we know all those who are practicing and that what they do with patients do not cause harm.
Collaboration between practitioners of traditional medicine and practitioners of conventional medicine is being encouraged and practiced in many African countries.
The benefits resulting from the collaboration between practitioners of conventional medicine and practitioners of traditional medicine are huge. Indeed, such evidence and benefits have been documented in some countries to include improved service delivery and quality of health care in Ethiopia and Ghana, increased patient referrals from traditional health practitioners to conventional health practitioners and to health facilities, such as in Benin, in Mali, in Burkina Faso, in Tanzania and South Africa, increased knowledge about the two systems of medicine. Within the context of primary health care, conventional health practitioners and traditional health practitioners have finally understood that they can blend together in a beneficial harmony using the best features of each system and compensating for certain weaknesses in each, which will supplement other efforts to achieving universal health coverage.
Notre problème, c'est la formation.
Training and supervision are major challenges. We hope that our governments will do what is necessary to promote supervision of traditional healers as well as their training in training schools.
We hope to see conventional health practitioners upgrade their skills in traditional medicine, and practitioners of traditional medicines as well strengthen their skills in conventional medicine.
The World Health Organization works with countries to strengthen their capacities in traditional medicine and conventional medicine. It is for this reason that the organization has developed training materials in primary health care for upgrading the knowledge and skills of traditional health practitioners. These training materials have been included in training programs of traditional health practitioners in member states, particularly in those countries where the practitioners of the two systems of medicine are working together as non-governmental organizations. And these countries include, but not limited to, Tanzania, Senegal, and Uganda. Similarly, the World Health Organization has developed training materials for conventional health practitioners in traditional medicine for adaptation in the curricula of health science students, and this adaptation is ongoing in some countries in West Africa, in Central Africa, as well as in Eastern and Southern Africa.
African countries are at different stages of collaboration between traditional medicine and modern medicine. They are committed to take key actions for scaling up the process.
Traditional medicine and conventional medicine should work together and fit each other for the health well-being of the population.
Je fréquente la médecine traditionnelle parce que j'avais commencé avec la médecine conventionnelle.
I use traditional medicine. I used to go to conventional health practitioners without results. I went to a traditional healer who cured me, but I continue to see conventional health practitioners for my medical examinations.
Depuis que je suis guérie,
since I've been cured, I've started working with traditional healers. I also collaborate with conventional doctors because I think that both medicines are complementary.
I would like to encourage all practitioners, both traditional and conventional, that this is a resource for our continent, and that we should do whatever we can to exploit this resource. And the best way to go about exploiting this is to have the collaboration between the two health systems. It's only through learning from each other and the advantages of each of the different types of health practices that we have that we can get the best benefit from both as complementary practices to each other.